Nationwide, the rate of deaths by gun violence this year is forecast to reach the highest level in 2 decades. And Chicago is on pace to reach its highest annual homicide tally in 25 years. The U Chicago Urban Network has been studying violence and its contributing factors, and this week is discussing how to make the city a model for rebuilding traumatized communities. Joining us now to share their insights are Dr. Kenneth Wilson, Medical Director for U Chicago Medicine's Trauma Center in Hyde Park, and Franklin Cozy-Gay, Executive Director for the Chicago Center for Youth Violence Prevention, which is housed at the University of Chicago and funded by the Centers for Disease Control and Prevention. Gentlemen, welcome and welcome back to Chicago tonight. Thanks for joining us. So, Dr. Wilson, let's start with you first, please. How would you describe the prevalence of gun violence among the patients that are treated at the Trauma Center at U Chicago?
Well, the biggest cities that we know to have urban violence problems, Baltimore, Chicago, Cleveland. Usually those numbers, if you take Chicago out of that, you'll see the percentage of penetrating trauma to be somewhere about 25%. Chicago, remember, we're not covering the whole city. We're just covering a segment of the city, the south side. That penetrating rate is 40%. During our summer months, it can balloon up to 50%. So we have a problem that you could say is twice as bad as any other city that we have, and we only cover a sector of the city.
Okay. I mean, what does that tell you? Because when you say it that way, the way you've just summed it up, for me, it sounds like a lot.
It's more than a lot. It's surprising when people ask me who are at other major trauma centers, LA, out to New York, who has a 50% penetrating rate other than Chicago? And I say, I don't know, because no one does, in my opinion. Like I said, Baltimore, which obviously is a city known for its urban violence, is at 20%. Atlanta's at 22%. LA is at 18%. And then you say Chicago's at 50%. 50% during its summer surge. No one looks like that.
Okay. Franklin Cozy-Gay, what do we know about what actually works to prevent violence?
Yeah, no, I appreciate Dr. Wilson sharing some of the statistics connected to that. When I hear those statistics, I also think about communities that have been economically distressed. And Chicago certainly has been economically distressed. Neighborhoods routinely under-resourced and often lack economic education options. And as a result, violence has been persistently high. So what happens? Essentially what happens is that you have an erosion of trust in structures and systems, because not only have they failed you, they failed your mom, they failed your grandma. And so with that being said, when you don't have trust, what is our approach? We have wonderful programs and resources that are available, but there is a lack of trust related to this erosion that has to do with systemic and root causes connected to structure that is directly tied to policies and practices that have been impacted by race and racism. So with that being said, some of the promising approaches have been approaches that rely on local programs because they have strong relationships and trust among the residents that they're looking to serve. With that trust, what we do at the center is provide capacity building support as well as coalition functioning support to help organizations that do have that trust build their evidence so they can demonstrate impact towards addressing making communities safer.
Dr. Wilson, back over to you. What more does the trauma center there do to prevent violence? Obviously, beyond helping treat the victims, for the injuries that they come to you with, but after they've technically left your care.
Well, that's a difficult part for us. Is we recognize what Franklin just mentioned is that once they exit the trauma center, we may have done a phenomenal job at fixing their physiology, repairing injuries that would have been life-ending, but the psychology of having those injuries, the things that got them in front of a gun to begin with, we cannot fix. As trauma surgeons we're so busy, as I mentioned, with the numbers. But we recognize it in such that we have those who are in their beds who are waking up with PTSD. We think about the Vietnam veterans, they all have it. So the only thing that we can do, well, I shouldn't say the only thing. One of the most important things that we do, since we probably are the most diverse surgical group at the University of Chicago, we actually have 4 African-American surgeons in this department, and I challenge you to find that in any urban trauma center anywhere in the United States, is that we mentor, we speak, we share our stories. Many of us come from these neighborhoods. I'm from Baltimore, which obviously actually ranks higher than Chicago for violent crimes. So the question is, how did you end up at Howard? How did you end up in the Army? So in any way that we can while they're in the building, we try to capture them, and we recognize their humanities. Their humanity. We don't allow people to use terms like gangbangers. We don't allow the police into our intimate conversations with families, especially when a loved one is lost. So at least in this environment, while we have them here, we try to do the best that we can to support them. But again, once they leave the building, our hands are kind of tied, and we look to the community violence recovery specialists away from our building to help us.
Franklin Kozige, we've just talked a little bit about, sort of like the penetration amount compared to, Baltimore and Cleveland. But we also know that Chicago's violence rate, it started to widely diverge from other big cities, specifically Los Angeles and New York over 30 years ago. Why does our violence rate seem to be so much more persistent?
Yeah, that points back to economic distress. I often cite a report that was by the Economic Innovation Group in 2018 that compared those top 3 cities. And what that report highlights is that in Los Angeles and New York City, their economic distress levels represent about 16 to 17% of their total zip codes, whereas Chicago represents 40%. So what does that mean? These are homes that education levels are low, being able to hold a job is low, business stability in the community is low, economic opportunities through workforce are low. So I think it's very important for us to look at the structural roots in terms of 40% of the zip codes in Chicago are distressed. Cook County ranks #1 of all counties in the United States as distressed zip codes, percentage of population of individuals that live in distressed zip codes. It's the violence that we're seeing is a symptom of a larger structural issue.
Okay, and obviously something that you two professionals are clearly working on, and thank you for taking your time to share your insights with us.
Thank you.
All right, thank you.